Good morning. Thanks for watching this video. The purpose of this video is to introduce my DNP doctoral project, to talk about the implementation of it, and also to act as a resource for the nursing staff caring for infants with congenital muscular torticollis. So my project centers around breastfeeding outcomes with infants with congenital muscular torticollis and how we can improve both recognizing and promoting early interventions for newborns within the first 2 days of life. So this will be before discharge from the hospital after birth. So the recommendations for the clinical practice guidelines were updated in 2018. And one of the recommendations within those clinical practice guidelines was to assess all infants for congenital muscular torticollis within the first 2 days of life. So there's a wonderful document that they have released as information for those who care for infants, and that is going to be the evidence-based guidelines on how to promote greater health outcomes, or excuse me, improved health outcomes. Within these instructions, it talks a lot about what torticollis is and what are some of the signs. One of the things that I noticed as a lactation consultant is we were seeing a lot of these symptoms with breastfeeding. So oftentimes, a quick definition of congenital muscular torticollis, or CMT, that's when the muscle that is the sternocleidomastoid muscle, one side or the other, is tightened and restricted in its movement. So you will find that the baby's head is both tipped and tilted and turned toward that affected tight side. This can affect breastfeeding because it can make it difficult for the baby to have total range of motion of their head and neck. It can also be transferred into the shoulders, and in fact, over the long term, can transfer to the entire body. So with breastfeeding, oftentimes what that looks like is the baby has difficulty latching in general, or particularly latching on one side or the other. So if you find a mom who has difficulty and they say, my baby won't breastfeed on the right side, for example, then it's really important to evaluate whether that baby is having some difficulty with that neck. And so the amazing part about this CMT treatment, or the early intervention, which is what we're aiming for here, is that if the baby begins therapy for this condition within the first 4 to 6 weeks of life, 98% of those infants will completely resolve in the condition and not need any further treatment and will not experience further problems from it. The problem lies in that it is often missed and there is not early intervention done. If that condition continues, number one, it can get worse. And so that baby's head tilt and twist will get more significant or more persistent. That can continue with continuing breastfeeding problems, or it can make actually other difficulties with the baby. You may see facial asymmetry where the jaw is tilted. You can find that the ear becomes pulled as well, so the ears are not symmetrical. And you can also find that the eyes are not symmetrical as well. If this condition persists, then oftentimes, because babies spend a lot of time on their back to sleep, as recommended by the Back to Sleep campaign to prevent SIDS, that can result in the baby having a positional preference. And so they tend to turn their head to one side or the other. When they're sleeping, this provides additional pressure on one side of the skull, flattening the side of the skull and deforming the shape of the skull. When that occurs, that's called plagiocephaly, and that's another complication of that CMT that then will need to be treated as well. Not treating the CMT at the same time as plagiocephaly results in less improved outcomes. You often will see a plagiocephaly that has progressed very far, ends up with the baby wearing a corrective helmet to correct the shape of that skull. So with these clinical practice guidelines from the Academy of Pediatric Therapy, then we can see that if we implement early changes and early treatment for babies with CMT, then we really do have the opportunity to eliminate this problem and prevent all of these future difficulties. So the goal of the project is to screen all of the infants before discharge and make sure that they are both identified and also that the resources for early intervention are provided to the parents so that then when they go to see their pediatrician, they can pursue whatever course of action is indicated. And in order to do that, one of the things that I'm doing with my project, of course, is raising the awareness and the knowledge and confidence of the nursing staff to be able to handle this with their individual patients. So the clinical assessment is going to be the first step, the clinical self-assessment is the first step in my doctoral project. So this is the paper that we will hand out to each staff member. They will fill this out to show what they know and what they don't know already. And then that that information is then disseminated about CMT to the staff members, and so that they have the resources to use with their parents. We'll then redo this clinical self-assessment and see if they have knowledge gained and feel more confident in promoting the early intervention techniques. The beautiful part about this is that the early intervention techniques start with some things that are super basic and that you should be doing with your babies anyway. So the assessment is just going to see, does the baby have complete range of motion of the head in that passive range of motion? Does the baby have any asymmetry in the face or the jaw? And does the baby have a head tilt or a positional preference to lean to one side or the other? So then if that baby is recognized as having those symptoms or those signs, those early signs of CMT, then the education piece goes into the family. And in that, we're just doing positional changes. We're doing a greater push towards that tummy time, which is, of course, is something that's so important that they get that information at the pediatricians later on. But for these babies with CMT, it's important to begin these things really, really early. So when we identify the babies that have those indicators of CMT, what this project is going to do is track every baby born in the course of 8 weeks and see, are we doing those assessments? And of course, this is part of your regular physical assessment anyway of the infant. Are we doing those assessments? Are we recognizing the signs of CMT? And are we providing the education to the parents whose babies screen positive? There will be a log placed at the nurse's station where the infant's information will be applied, and just the 3 questions. Did the baby get a screening assessment? Did the baby screen positive? And if so, did the baby's parents receive the information and education that they needed? So there are 2 things that we can provide for the parents of the babies with congenital muscular torticollis. And these are 2 handouts that will be available for them to receive before discharge. It can be done at any point or it can be done at discharge. And basically, it's an informational handout to begin with. And this is going to be 5 tips for positioning and playing with your newborn. And this is put out by the Academy of Pediatric Physical Therapists and suggesting how they can prevent and intervene with this CMT before it gets too significant, while they're pursuing referral with their pediatrician as needed. And then Children's Healthcare of Atlanta also has a wonderful handout which we can use with the parents, and that's called Tummy Time Tools. And this is going to be another handout that's available for the parents. And in these handouts, it's going to talk about the basics of early intervention. And it really does overlap with normal healthy care of the newborn. So in this case, we're talking about changing the baby's position on a regular basis, especially for those babies who have a positional preference. So the baby who constantly tucks to one side or tips their head to one side, then we're going to want to straighten out the head. We're going to want to make sure that the head is turned both directions. This is really convenient to link with diaper changing. So we recommend to the parents that every time they change the baby's diaper, they make sure that they tip baby's head both directions, turn it side to side, and then after that diaper change is done, turn the baby over and lay them in their tummy and have that baby have an opportunity to turn the head to both sides and to lift the head and exercise those neck muscles and upper back muscles. The other thing that's important to remember is babies should be held as much as possible, especially in the early weeks, so that they're not constantly lying on their back with pressure onto the skull. That gravity-induced pressure on the skull will increase the chance of either flattening on the back, or if the baby has a positional preference, flattening on the sides, which creates that skull deformity. So holding the baby and remembering that tummy time does not just mean that baby is laying on their tummy on a blanket. Tummy time means the baby is being held like we do skin to skin in the newborn phase, being held against the parent's chest, being held across the parent's lap, belly down, giving them a back rub while you're laying them across your lap, giving the baby a burp, making sure when you're holding them up on the back, up on the shoulder, that you don't just do one side. Because if we put the baby on both sides, we encourage the baby to look to both directions and use those bilateral neck muscles and movement. And then, of course, making sure that we don't put them in various baby containers for too many hours a day. So that can be a bouncy seat, a swing, any kind of number of those things that's going to put them at that reclined angle to provide pressure on the skull. So the goal is to make sure that we get all of these, all of the babies that we have to have that screening assessment, and then make sure that we give that education to the parents. This log will be placed in the nurse's station. It'll be covered with a cover sheet for privacy so that that information isn't just left open and available for viewing, because it does pertain to HIPAA compliance and making sure we keep that privacy. And I'll have a cover sheet. Make sure that you remember to put me on my tummy. Make sure you change my head position. And don't forget to put my information on the log. This information will then all be assessed after the completion of the project, and hopefully we will find positive outcomes for our newborns that are experiencing challenges with this mobility and this neck restriction. The goal is to improve these health outcomes, both for breastfeeding and for general health care of the newborn. And if you have any questions, then please, of course, feel free to reach out to me. I'm going to put this video as an available resource, and then any kind of additional information I can provide. These handouts will be available for use with the infants, parents, and then, of course, any questions you have about the project in general, you can call me or you can email me, or grab me in person if you're there at the hospital with me. And then hopefully we can really make an impact for these infants who are struggling with breastfeeding, as well as prevent future problems. Thanks again for watching this video. I really appreciate your time, and I really appreciate your participation to make this project a success.